So we're nearing the end of PCOS Awareness Month, and I did not want to finish out Advocacy Month when it comes to talking about this without going over a couple patient questions that honestly kind of go together, and we get asked a lot as PCOS providers of care. And one of them is is it safe for a PCOS patient to have electrolysis and or laser? And the short answer is yes. Okay. The long answer is management of your symptoms with PCOS, finding out if there are other comorbidities with your diagnosis might change how your progress moves along in hair removal. Okay. So certain medications might suppress androgen excess, which androgen excess is what's growing those hirsute hairs. Okay. Other medications might excite, so might get you more hair, especially if we're trying to replenish what's on top of our head. And then there's also things like healing, medical procedures we might be going through that just might make changes in how your hair presents on your body. And it is always really important to have an open dialogue with your technician and your doctor and make sure everybody's on the same page. Because while it works, what really stinks is if you're going through all this and you're like, doctor doesn't know that you're having electrolysis, and they put you on something that is going to stimulate your androgens, okay? It's going to make more hair. What ends up shifting in that space is you end up having to kind of chase new hair growth in the areas that were already hirsute-based growth. If your doctor is trying to navigate new medications with you, so trying to try new birth controls or spironolactone, or you're doing new procedures like having a hysterectomy or an oophorectomy, and there's going to be a major shift in your hormones, you may see changes down the road. Be prepared for them. It still works. In fact, some of these things will expedite your progress because we're no longer feeding those hairs with that excess androgen. But stay the course because it works, okay? Throughout our lives as PCOS patients, and I'm talking on the patient side of things, is we're gonna go through hormonal shifts outside of our PCOS that could encourage new growth. Don't be discouraged by that. You already had the propensity to grow hair. We're just trying to go after and kill the new ones, okay? But ultimately, you will get to that end result. And in most cases, even that maintenance that you might have to encounter down the road, depending on where you initially started your process of permanent hair removal or permanent hair reduction, might shift what that looks like. And in great ways. And it's worth every moment. For me, it was worth every moment for me. Now, part of that is I got to meet a really cool community of PCOS advocates like myself, okay? And I got to learn how to use my voice in medical environments that I otherwise was not comfortable. I always thought, well, they know it all, and what do I know, right? But I got to understand that I like to research the heck out of things, and I get to know more about myself, and I get to know my body better than anybody because I live with myself 24/7, 365, right? And our doctors don't get that same insight. Neither does your electrologist or your laser technician. We get a moment of you, but you get to advocate for you in those spaces. And you are going to be the loudest voice in your advocacy when it comes to going through the process of permanent hair removal, through medical changes within your PCOS, through any medical goals that you have for this. And we, as your providers, get to cheer you on and elevate that. But as providers, we also have to listen, right? We have to turn both ears on and close the mouth and just listen to that empathetic side of if you haven't experienced it, open your mind to the possibilities that your patient has at mass amounts exhausted all efforts of research, and it's time to listen, right? They've been through multiple providers. The average patient is 5 to 7 doctors before they even get a diagnosis, and that diagnosis doesn't necessarily mean they're gonna have care. And here in the States, care doesn't mean that it's FDA approved. Most of the stuff is going to be off-label usage for PCOS. They have just found a way to make it work. Now, the advocate community and a lot of really amazing medical providers are working for those changes. And even in my links online, You can go and look at the 2023 guidelines that we finally have, like evidence-based, multiple types of medical providers talking about this. Last year, we got to have our first FDA focused patient drug development meeting. Big things are happening, right? And we're all learning together, but we got to open up those ears. We got to be ready to take in new information. Our patient's experience needs to be documented so that we can then start to create the information that we need as providers to fill in the blanks of what we don't know yet. PCOS is not talked about enough yet, and that's why we have advocates at this level, okay? We need to get loud. We need to go teal. We need to elevate voices of our patients. If you're a patient, elevate your voice. Talk to your fellow PCOS patients. Elevate their voices. Understand that this impacts a lot of bodies. 21% worldwide, 21%. That is a large percentage of patients faced with PCOS. So we have to listen. And we have to get studying and get to know these things and get excited about researching these projects and advocate left, right, center. I don't care. You have to get loud about it because electrolysis works, laser works, medical pathways work. You just have to talk about it. That's it. Peace, love, and hair removal. Bye, guys.